Focus of this slide is appendicitis. Here in this slide, we're going to go through the pathophysiology of appendicitis and the signs and symptoms, and also the diagnosis, treatment, and patient care. Let's start. So as you see here in this image, the location of appendix is at the end of the cecum, which is located here. And so this is like the zoom in, while the appendix, see it has the inflammation in it. So normally it's like a small foam, like worm shape at the end of the appendix. Like here we have a small intestine, and this is a colon, ascending colon transfer and descending. So it's just like it is in ascending, which is located in the right side of the body. Different reasons can cause the appendicitis, but if we pay attention to all the reasons that causing the appendicitis, we see that they're acting the same way. One of the most common causes of appendicitis is like, if you call it that, like closing the way of the appendix. So in this way, you see that like the normal flora as well as bacteria cannot pass and get out of the appendix. This usually happens in the young kids, like around age 10, and those patients that they usually get constipation. So that's normally you see that obstruction that is happening in the appendix. Another group of patients that they can get appendicitis is the foreign body, like seeds, something like get there and block the appendix again. And then again wouldn't let the normal flora of the appendix as well as the other bacteria get out of there. And there is another reason, which is like as you see here in the image. So this is the normal. If this is a normal appendix, this would be the appendix with a enlarged lymphoid follicle. So as you see here, so it's just like the way that like the bacteria or normal flora that wants to get out of there will get closed. As you see here, the inflammation will happen, swelling will happen, and then it's closing it. So in all three causes that you see here, you see that like always the bacteria is stuck here in appendix, and then when bacteria is stuck here in appendix, it's just like causing inflammation. With any inflammation, you would see the white blood cells moving towards the part that has inflammation. And also the inflammation that is happening here, it will put the pressure on the blood vessels that's supplying the tissue of the appendix. And with like putting the pressure on the blood vessels and all the inflammation, so it's making a good environment for bacteria to grow, because the tissue start to have a necrosis and then die. So it's just like making a good place for bacteria to grow. And eventually like the appendix will have like lots of bacteria that is growing in there, and tissue will start to die, and the patient will feel pain and other signs and symptoms that we're going to go through it. But if we don't figure out this condition early enough, then like as the tissue start to have a necrosis, it and inflammation increases, the number of the bacteria that is growing there increases, then eventually we'll see that the rupture happening in appendix. Now let's see uh, what would be the complications of this, this earlier. So eventually, if we don't recognize that the patient having appendicitis, then this appendicitis will rupture. And with rupturing the appendicitis, you would see the bacteria, bile, everything that like it's in there is getting out of the appendix, and it will like making the other part of the stomach exposed to those bacteria. And then when this bacteria get into the stomach area, then we have a peritonitis. So that's the condition that would happen and complication that you would see in the patient with appendicitis. So peritonitis is the inflammation of peritoneum area in the stomach, and it may cause like by different like situations. Mainly like it happens like having like exposed bacteria and chemical in the stomach, which happens secondary to the appendicitis and rupturing appendicitis. The signs and symptoms that we see in a patient, most of the time they come with a pain that is persists and doesn't go away. The pain usually the patient feel around like umbilicus, and then gradually start to transfer to the right side. The other signs and symptoms that we would see in a patient, it's nausea, vomiting. The patient, like as a result of the feeling nauseous and having vomiting, they start to lose their appetite, and they won't be able to eat. And then as a result of the white blood cell that like gather around the tissue that has the inflammation and infection want to fight with the germs and bacteria, the patient would have a low-grade fever. So these are some of the signs and symptoms that you might be see in your patient. The other thing that you might see in your patient is that they prefer to lay still, just like they have too much pain to move, and they like to flex their leg, especially in the right side, to help themselves to have a comfort. Also, if you touch their belly, you would see that like it's rigid, and then they keep the muscles like in a contraction position, which like is like kind of like we call it like a board-like stomach muscles. For the diagnosis, what would we look for it? While we are doing examination, we can look for different signs and that we see during the examination. One of the things that we can do in a patient is that finding out that which part of their belly having a pain. So if we divide this in four parts, you would see that like in the right lower quadrant they have pain. And like when you're examining, palpitating the patient belly in the right side, you would see that there is a point that usually they say that they have more pain, which this point is usually known as McBurney point. So McBurney point is almost halfway from umbilicus to the right iliac crest. So if here is a right iliac crest and umbilicus, so it's almost halfway between these, and this is known as McBurney point. Another thing that you can check in your patient is known as rebound tenderness. So what is rebound tenderness? Is that when you are examining the patient, when you push in the side that the patient have a pain, so usually when you're releasing that, patient usually express more pain during the releasing, more than the time that you're putting pressure on it. It doesn't mean that the time that we are putting pressure on it, the patient doesn't have pain. The patient have extreme pain, but when you're releasing, it will be even more tender. And there is another exam that we can do on a patient, which is known as a roof sign. That's like what we're going to do for that. How can we do the exam? So here in this case, our patient having a pain on the right lower quadrant, as I mentioned, like you dividing it into 4 sections. So what is happening? You're putting a pressure on the left lower quadrant of the stomach, and the patient will feel the pain on the right lower quadrant of the stomach. So all of this that we are talking about is the sign that our patient having the inflammation, and like this inflammation having the effect on the other organs of in the body. So that's why they are having pain in the in those areas. Another exam that we can do is the source sign. So what is happening here is that we tell the patient to lay down on their left side, and then we move the leg on the right side. And what is happening with the extension of the leg on the right side, the inflammation that is happening there, it would have effect on the psoas muscle, and that's why just like the patient will feel pain, and that's why the name of this exam is psoas sign. It's just because of the muscles that is in this area. Another exam that we can do in a patient to figure out if the patient have appendicitis or not is obtuse sign. So in obtuse sign is that we tell the patient to lay down on their back. Then what we are going to do is that we're gonna uh, flex the uh, knee, and then the right knee we bend it, and then meanwhile while we are bending the right knee, we will stand in the right side of the patient, and then I will put one hand on the heel of the patient and the right hand on the heel of the patient and left hand on the knee of the patient, and we try to slowly rotate the patient's right hip. So as we rotate the patient's right hip, then the patient will start to having a pain. And then so with this one, the inflammation that is happening there, it put a pressure, more pressure on the abdominal muscle as you see here. And then that's why the patient feel a pain, and the name of this exam is obturator sign. Now, look at more way that we can diagnose this condition. So if we get a history from patient about like the patient having ongoing pain from start from umbilicus and get to the right side, and then the patient will say all those like signs and symptoms, and then during the exam we see that the patient have a positive social sign and obturator sign, then still if we are wondering if the patient having appendicitis, the thing that we can do is doing a CT scan. So CT scan is usually preferred diagnosing way. Why? Because other than that, we can see the inflammation as we see here in the image. Other than we can see the inflammation happening in the area, also we can see it if the ruptures happens or a peritonitis, the patient have a peritonitis or not. So in case that like our patient is pregnant, we have a pediatric patient, another way that we can do the diagnosis is usually doing the ultrasound. So ultrasound is very safe way to diagnose the condition. And then with ultrasound is that, like as you see here in this image, you would see the inflammation that is happening in the appendix. Uh, Another way that we can figure out if the patient is having an infection, which is like happening in appendicitis, is doing the blood test. Usually when we do the blood test, you would see the normal level of this white BC is usually between 4,000 to 10,000, and in the patient with the appendicitis, the amount of the white BC increasing to more than the 10,500. And another thing that usually increases in the patient with appendicitis is that the amount of the neutrophils. So neutrophils is always telling us there is an infection happening in the body, and the normal level is like about like 2,500 to 7,000, which is increasing in the patient with appendicitis about like 75% more increase in the level of the neutrophil you would see in this patient. What treatment we can do for the patient with appendicitis? How can we help these patients? So of course we will do all those lab to figure out if the patient having appendicitis or not. Like another thing that we can usually do is just doing the urine test to make sure it's not kidney, it's appendix. And then after we figure out that our patient having appendix is that we need to know that if the appendix having the abscess, if the appendix having ruptured, if the patient having a peritonitis or not. And then based on that, the treatment that we start would be different. For example, if the patient having an abscess, before we start the surgery, first they're gonna suction the abscess, or sometimes like for peritonitis is that First, they just like suctioning the area of the peritoneum that has an infection. And then for all the cases, they start like having an IV for the patient, um, because like as a result of the infection, the patient can get dehydrated. So we need to start IV early for this patient to like hydrate the patient. And then also we start the antibiotic for the patient. So keep in mind that we put the NG tube for the patient to like we will put it in the intermediate suction. So just like suctioning the um, fluid acid that is in the stomach. We put the patient in semi-flow position because that helps with the pain. We start the IV fluid for the patient to replace the electrolyte and also hydrate the patient. If the patient needs the oxygen, we give the oxygen to the patient, and also we start the antibiotic for the patient. These are the most common antibiotic that you would see. There are lots of group of antibiotic that you would see. It's possible we give it to the patient with appendicitis, but the most common one is ceftriaxone. So ceftriaxone is in the cephalexin group, is in the third generation cephalexin group. So from the first generation, when we move to the third generation, it's just like they are effective in both gram positive and gram negative bacteria. So that's why we're going to choose the third generation of the cephalosporin group. And then usually with either like ceftriaxone or ciprofloxacin, another medications that we give combined to this antibiotic, either one that we choose, is metronidazole. So metronidazole is the antibiotic that is working on anaerobic pathogen bacteria. And then so we would see like those anaerobic pathogen usually in the digestive system. So we combine these medications together, either like metronidazole and cephalexin, or metronidazole and then ceftriaxone, and we give it to the patient that having the appendicitis. There are other medications that possibly we can give to the patient with appendicitis that could be helpful, such as the Zosyn. That could be another medication that we can give to this group, to this medication. And of course, the patient that have appendicitis is considered as the emergency surgery. So always we need to do a surgery as soon as possible before any complication happens to the patient. So we will do the surgery on the patient, and then about like after surgery, the patient can start like when can like be able to walk, like doesn't have a pain. So we ambulate the patient, as well as we start like putting the patient on the food, and then of course the food that patient would be able to tolerate. We are done with this topic. If you find this slides helpful, please hit the like button and also subscribe, so it will come up and other people can get the benefit from watching this presentation. Thank you.